We're living through a medical revolution. AI is diagnosing patients, writing prescriptions, and in some places, even running full hospitals. But while the tech is impressive, the impact on real people, especially marginalized groups, is a lot more complicated. In this episode, we're breaking down 5 real healthcare studies that show where AI is taking us. Some of it's groundbreaking, other parts, genuinely alarming. China launched an experimental AI hospital that can treat 3,000 virtual patients per day, entirely run by artificial intelligence. The system diagnosed diseases, prescribed treatments, and completed the equivalent of 6 years of clinical rounds in just 1 month. The AI not only made independent clinical decisions, it learned from each one and improved over time. According to the creators, it even outperformed human doctors in some areas of diagnosis and efficiency. This AI hospital isn't treating real people yet. It's training on thousands of virtual patient cases to test how well AI could one day manage actual care. So, why does this matter? Because it challenges everything we know about medical training, liability, and trust. Could future hospitals actually run on code? And would you go to one? According to a 2022 study, most dermatology AI tools are trained on images from light skinned patients. Up to 95% of data sets are skewed towards lighter Fitzpatrick skin types. That means these AI models are significantly less accurate when diagnosing patients with darker skin tones, risking missed skin cancers and delayed treatment. AI can be powerful, but if it's not trained on diverse data, it reinforces the same racial gaps we are already fighting in healthcare. A 2023 Health Affairs review screened 11,647 studies on healthcare algorithms. Only 109 studies, that's less than 1%, included any strategy to address racial or ethnic bias. But here's the kicker: only one study tested a bias mitigation strategy in actual clinical practice. Just 3 studies tested proposed fairness frameworks in real world settings, and only 7 compared the effectiveness of different bias reduction techniques at all. In short, even among the small fraction of studies that care about bias, most don't test their solutions or even explain when or how to use them. Without transparency, testing, or stakeholder input, these tools are being designed in a vacuum and deployed in hospitals anyway. The authors concluded that real health equity can't happen without a new standard called health equity by design, baking fairness into the algorithm from the beginning. A 2024 research review found that AI tools used in hospitals and clinics often make racial and ethnic disparities worse, not better. Here's what they found: Black and brown patients were more likely to get wrong diagnoses, risk scores were often less accurate, some tools gave worse treatment recommendations, and emergency room systems sometimes ranked them lower priority for care. Why? Because these tools were mostly trained on data from white patients, so they missed patterns in people from other racial or ethnic groups. The researchers warned people think AI is neutral, but it often repeats the same biases already in healthcare. A 2024 study tested 2 diabetes risk models, one that used race and one that didn't. The race blind model gave inaccurate results for people of color, especially Black, Hispanic, and Asian patients. It often underestimated their risk, which could mean not getting screened in time. The race aware model was better at identifying who actually needed care, even if the number of changed decisions was small. The differences were meaningful. The takeaway: trying to leave race out of medicine doesn't make care more fair. It can actually make care less accurate for people who are already underserved. So, what did we just learn? AI can now practice medicine in virtual hospitals and outperform some doctors in some key areas. But it struggles to diagnose darker skin tones. Almost no clinical AI studies even try to address racial bias. Many actually worsen disparities in diagnosis and treatment. And when race is left out of risk scores, it can leave the most vulnerable people behind. AI isn't neutral. It learns from the systems we've already built. And if those systems are biased, the AI just automates that bias faster and wider. That's why we need transparency, testing, and diverse data before we trust these tools with our health. We need not just better algorithms, but better intentions built into the code.